Hey everybody, Dr. Deom here for another eye care today. It's been too long, but we are back with another great episode. Don't forget, we are in 4 fantastic locations. Hazleton Eye Specialists, that's 281 Airport Road, Hazel Township, PA. You can't miss it. We have the big eyeball out front, and you'll see the beautiful new landscaping in front of the big eyeball in Hazleton. Of course, we're accepting new patients. And in Stroudsburg Eye Specialist, in our Tannersville location, which, you know, you could go shop, do some shopping, and head right on down to see Dr. Bellinger and Dr. Olzinski. Just fantastic doctors, beautiful location, wide array of frames, lenses, fantastic staff, also accepting new patients. Also a new retina specialist there in our Stroudsburg office. So we have retina specialists at all of our locations now, but brand new Dr. Cody in Stroudsburg, fantastic Ivy League trained, really top-notch retinal surgeon there in Stroudsburg. So if you or your loved ones in the Poconos have macular degeneration, diabetes, any retinal concerns, and you need a retina specialist, if you're getting injections, you're driving too far, you want someone closer, really fantastic, top-notch doctor there at our Tannersville location, right behind the Friendlies on Route 611, just down the road from the Tannersville outlets. Pottsville, you can't forget the Skook. Pottsville, we absolutely love Pottsville and the Schuylkill County area, and we are so lucky to have the fantastic Dr. Akirta Sran, Dr. Brendan Connors here 99% of the time, but I'm also here one day, and we also have a fantastic new doctor by the name of Dr. McCall here in the Schuylkill County area. So we just have you covered really from top to bottom, everything here. We also have a brand new retinal specialist here in Pottsville, Dr. Patel, who many of you do know. He'll be now in our Pottsville area seeing patients. He'll be starting out about once a month, but we're really excited to bring another retinal option to the Pottsville area. So Dr. Patel, who many of you met in Hazleton, will now be in our Pottsville location. And really exciting, over the last year, we were able to enter into the Wyoming Valley market. An interesting, opportunity for us came to light. Difficult situation, actually. The passing of a good friend of ours, Dr. David Evans of Evans Eyecare, an office that was a staple of Nanticoke for the last 30 years. And boy, are we really grateful to have the opportunity to be in Nanticoke with the very well-known, respected Dr. Cindy Charnetsky, who was at a local eye care facility in Mountaintop for 20 years and is now bringing her talents to Nanticoke with our new team there, Nanticoke Eye Specialists, and Dr. Allie Wylam, who will be in Hazleton and also in Nanticoke. So boy, is it exciting, because we are growing. We are growing alongside of you and your family, trying to meet your needs and meet the needs of the growing area. And it's just very exciting. And I couldn't be more grateful to be a part of this team that takes care of all of your needs from birth on. And, really every eye care need, we can, if we can't take care of it in the office, we have specialists that come to our office that can take care of it, or we'll make sure we'll get the right person for you. So, the care that we provide in our office is obviously, between the doctor and you. But the other part of what we do at Hazleton, Pottsville, Stroudsburg, and Nanticoke Eye Specialists is in the community. We take great pride in sponsoring several Little League teams, supporting church events, supporting initiatives at schools in the community, funding numerous activities throughout our region. Take great pride in that. And, you know, one of the things that we try to do is inspire our doctors to become part of the community. You know, Dr. Kislin started this office, you know, 20 years ago, and now we're 8 doctors strong. And not only are we 8 doctors strong, but we've brought 4 young doctors to the northeastern Pennsylvania area. And we've inspired them to, you know, want to be members of this community. And as somebody from this area, I'm very proud of that. And, you know, I'm very proud of all the great work that Dr. Sran has done, not only in this community, but throughout the world. And so, you know, that's really what we're going to focus on here today. Dr. Sran has a big heart and has always had a passion for giving back. And it was part of, you know, really the agreement, if you will, that she was going to be joining this practice alongside of Dr. Connors, her husband, that she would be able to, you know, spread her passion for giving back in the community. And so I want to say thank you, obviously, for being part of the community and, you know, being part of the practice. And something very exciting that we're going to talk about here on the remainder of this episode of Eyecare today, and that is a trip that you went on recently, right? So where did you go?
So first of all, thanks for having me.
Of
I'm
course.
happy to be here. I went to Guatemala, to specifically a small town called San Juan Zacatepeques, and so it's about 200,000 people, and
Okay.
I'll tell you about my adventure there.
Wow. So would you call this a mission trip? Would you call it what would you call this type of trip?
Yeah, so it is a mission trip or a service trip, humanitarian trip, all words apply. So this trip is designed to help patients who are underserved and in need and don't have access to eye care or the resources needed or the finances needed to be able to access the eye care that may be available to them. So
where did passion for something like this come from?
So for me, I think if you watched the last episode I was on, we talked about just my childhood and upbringing and traveling to underserved areas, for example, India, seeing poverty, seeing people in need is what kind of inspired my passion to help others, and then that went into my career choice, and then forever it was with me that even no matter what I end up doing for a career that helps others, I still want to be able to go help others in areas that, you know, aren't necessarily where I'm practicing or helping my patients again who are in extreme need for care. So for me, back to that hot air balloon story, is like, how can I deliver supplies to patients who need it? I'm gonna go around on a hot air balloon and deliver them around the world. And obviously, like I said last time, that's not possible, but there are other things that we
Might have a
could
Hazleton
do.
Eye Specialist hot air balloon coming your way.
Right.
So, you know, again, born with the desire to give back and now living in the northeastern PA region, we're lucky to have her. Dr. Akirta Sran, and we're going to be learning a lot more about her adventures on Eyecare today. Hey everybody, Dr. Deom and Dr. Akirta Sran with you today on another Eyecare Today. We are so excited to be telling you about the adventures of Dr. Sran, giving back to those in need around the world, but also right here in our community. We are so excited that you're joining us today, but we also want to invite you to be part of our practice. We have 4 fantastic locations, 8 wonderful doctors of optometry, and our retinal surgeon colleagues and cataract surgeon colleague who are ready to take on all of your eye care needs at 4 fantastic locations: Hazleton, Pottsville, Stroudsburg in Tannersville, and now Nanticoke. So really we have you covered from north to south, east to west in northeastern Pennsylvania. We're here to take care of you and really give you something extra. Really one of the only family-owned, if you will, locally owned eye care providers that remain in the area, and we're very proud of that. And as such, we really try to inspire our doctors and support our doctors in being community led, community focused, and really just very exciting that Dr. Sran, gave of her own time to go and give back. And so that's what we're talking about right now. And you were just telling us a little bit about how this came to be, sort of where the inspiration came from, all the way going back to as a child wanting to, ultimately do something that gave back to others, visits, to other countries where you saw how people live in different places, just thought, you wanted to always give back. And so I know as a student, you also were part of an organization that was focused on giving back. Can you tell us a little bit about that?
Yeah, so definitely when I entered optometry school, or even just when I was interviewing, I knew that I wanted to make sure the school I went to was participating in SOSH, which is Student Optometric Services for Humanity. And that was my goal. During optometry school, I'm going to be able to go on a service humanitarian mission trip. And so for our year, our fundraising for the years before that led up to it was to go to Haiti. But unfortunately, just a few months before our trip in August to Haiti, the Prime Minister stepped down. And so that created unrest, civil unrest in the area. So a lot of fires, riots, unsafe environment, of course, to travel to. More unsafe than it was originally. And so the school decided that it would be best for us to change the trip at that time and go to a new location. So at the time, of course, with it being so last minute, trying to organize, find an area that is in need that we could go to and help, we ended up going over to Compton, California. And so our trip that year, we went there and got to see a ton of patients from all different backgrounds, all different...
Was Snoop Dogg there?
No, he wasn't.
Snoop Dogg was not there, but lots of people that needed help.
Yeah, definitely. So that was my first trip. Obviously a different experience than leaving the country, but still a very humbling experience because even here in our own country, there are patients that are in need. There are people who don't have access to eye care, and that again circles back to us here. And why I loved coming here and being a part of this practice is we're in a rural area. We're underserved. There is need for eye care. There's patients with a lot of disease who need help, and that's what we're here for.
Absolutely. So. Yeah, and we're going to keep tying that thread throughout this because I could just hear, somebody sitting at home, what did you go to Guatemala for? There's people here that need help. What did you go there for? I could hear you yelling in your lazy boy saying that. Well, we have an answer for you. So hang on to that thought, but listen to this wonderful job that you did. So here you are in practice. You said, I'm only coming here if I can do good. So we said, go ahead, figure it out. Organize it, do it. Well, we would love to support you. And so you did. You went and you organized this trip. So this trip was with an organization called what?
VOSH. So they're Volunteer Optometric Services for Humanity, and they partnered with Eye for God Ministries. So it was a combined venture, and they've been someone I've signed up with at one of my optometry meetings that, okay, I want to be notified as a doctor of optometry when you're in need for a provider to go on a trip each time you have a trip that needs someone, so that hopefully eventually there's one that I can be a part of. So I've been getting emails for different trips, and finally this one was one that I could, make everything work for. And obviously with your help, and like you said, I wanted to be here because I wanted to help others, and so that again goes obviously for the area, but beyond that. And with VOSH and Eye for God Ministries, I was able to be part of this trip. It was 2 ODs from the United States, 2 doctors of optometry, and 4 doctors of ophthalmology, or MDs, that are surgeons. So there was also nurses, translators, and we also had a Guatemalan doctor of optometry as well. Obviously different way to go to school there, and it's a very different learning process and scope of practice, but amazing to have as many people as we could helping us during that trip, because there were a ton of patients in need for the, we were there for six active days, 5.5 of patient care, and patients are lining up at 5 a.m.
So I want to talk a little bit about the preparation, right? Because you don't just hop on a boat or hop on a plane and go, to a third world country, right? You have to prepare, got to know what you're getting yourself into. So there was some of that, right? And like you said, this worked in your schedule, it worked with us, it all worked out. But you didn't pick Guatemala. Like off a list, that was
Right.
somewhere where you wanted to go. The time lined up, so you said, well, I'm going to do it. There's something I want to do. I know there's great need there. So then you had to figure out what you needed to do. So what did you have to do to get ready to go?
Yeah, so in order to go, like I said, to a developing country, there are obviously a lot of differences in how they live and things that are that we'd be at risk for because it's not our normal environment.
Yeah.
So I did go see like a travel doctor, travel nurse, and you have to get certain vaccinations for certain conditions such as traveler's diarrhea or yellow fever or malaria, which not all of those were what I needed in my case, but those can be needed in certain areas. So getting certain vaccinations, making sure you are equipped for things you can and cannot do. For example, the water there is not safe to drink at all, which includes brushing your teeth or putting in your contacts. Like you are using a water bottle for all of that because you cannot get the water near your mouth because it is not safe for you at all.
Wow.
So things like that. And then, of course, there's a lot I learned once I got there that is different in how they live.
Unbelievable. So, just a big undertaking, a lot to organize, a lot to think about, to go and give of yourself, to go and take away time from, ultimately making money, right? You're here, you're making money, you're seeing patients, you're expending money too to go there, obviously. So, you're taking time away from work, you're spending money to go and do something, and ultimately, what are you getting in return for it? Well, you got to get a bunch of vaccines, you got to watch what you eat, doesn't sound that appealing, right? But ultimately, it was a wonderful thing. And so we're going to talk about, what happened when you got there to Guatemala and all the wonderful people and lives that you changed just on the other side of this break. Hang in there. We'll be right back. Hey everybody, Dr. Deom here on another Eye Care today, and we are talking about a just fantastic journey that Dr. Akirta Sran embarked on earlier this year when she gave of herself to really change lives in the developing country of Guatemala, helping scores of patients. And we're going to learn about that right now. And don't forget, we have 4 fantastic locations: Hazleton, Pottsville, Stroudsburg, and now our newest location in Nanticoke. If you're in the Wyoming Valley area, Chickasha, Hunlock, Wilkes-Barre, Scranton, anywhere, now we have a closer location for you. Dr. Cindy Charnetsky, who maybe some of you know from the Mountaintop area and also Peckville. She practiced in those areas for close to 20 years and is now bringing her expertise to our Nanticoke location alongside of Dr. Ali Wylam, who is one of our newest doctors, and they're both in the Nanticoke location there to help you with all of your eye care needs, really from birth on. Happy to help and take care of you there. But we are today in our Pottsville location. So we're here today in our Pottsville location. You can't tell, but that's where we're at. We just had a Yingling with Dick. I'm just kidding, we didn't. But we're right down the road from the Yingling Brewery here in the great little town of Pali. It's actually Pali Alto, but we're in Pottsville zip code, I guess you could say. But we love it here, and Dr. Sran is here most of the time alongside of her husband, Dr. Brendan Connors, and very excited too that we have a new retina specialist here every month. So those of you in the Schuylkill area who have macular degeneration, diabetic retinopathy, if you're receiving injections right now, you're driving too far, you're having difficulty, with the care where you're getting right now, brand new location, specialty suite. Actually, where we're located right now is our specialty suite, and we're very excited to have him here. So Dr. Sran, you were telling us about this fantastic journey you went on to Guatemala. So for those of you that don't know, Where is Guatemala? Can you tell us, where is it? What continent is it on?
South America.
It's in South America. Fantastic. Give us a high-level overview. Guatemala, what is it like there? What do the people do for a living? What kind of education do they get? What kind of income do they have?
Okay, so just in general, kind of localized to the area I was at again, San Juan, Zacatepec. The population's around 200,000.
It's a pretty big city. Yeah.
And education level, really variable. Elementary school at kind of almost at most 10% maybe go to high school.
Okay.
And then of course, like I was working with some of the few who were in school for translating.
Okay.
English translation,
Sure.
Spanish English translation, and then some who became doctors of optometry through their programs there.
Fantastic.
So it's not necessarily the easiest place to get an education. Why? The level of poverty is extreme. And a lot of that has to do with the access that they would even have. Budgeting for their area is not available to them because of corruption in their government.
Right.
So the patients there, the people there, they're very kind-hearted people, very sweet people. You could just tell they're just very happy with their lives there, and they're just wonderful people who are, wouldn't ask for anything more because they are happy with where they're at. And so I think that's something, again, to take away from doing something like this. It's very humbling. We have a lot to be thankful for, and it's above and beyond.
What we need.
Yeah,
right?
absolutely.
So when you walk down the road here, there, what's it like? What do you see? What do you hear? What do you smell? Can you take us through that?
Yes, of course. Just thinking about the view there, all the roads are different kind of infrastructure, very tight. Cars are very crammed going through the roads. It's a mountainy area. A lot of little shops along the side of the road, dogs running stray, chickens running stray. People on bikes with kids and no helmets, people in the back of trucks just
a whole different
piled
world.
in buses where people are just climbed on the back, hanging on onto a ladder. It's definitely a different lifestyle. In terms of like what we think is safe and all of that, it's not the same. Sanitation, very different. Piping is different. Can't even flush toilet paper down the toilet because the piping's too small. So it's just a different, like I said, different lifestyle. Water is not safe. Different bugs, different sicknesses that are more prevalent just because of the level of availability of hygiene and care. A lot of handmade. If you look at the people, beautiful handmade outfits. They're hand embroidering and beading a lot of their clothing, and it's absolutely stunning what they do. They're so creative and very good at what they do. So it's amazing to see, that
what they could do with so little.
That they can,
They're not sitting TikToking all day. They're making things. Some of them.
Very different.
So the access to care obviously is not very good, right? So they put out this message in the community. Hey, we're going to be here. We're going to provide care. So what does this look like? What is the clinic experience? Tell us about this.
So I'd say anywhere you go, it's going to be very different. In my experience, where I got to go, we set up at a police or military school.
Okay.
So we were located there. We had the military with us like 24/7, with us driving us. It was very safe. And we were set up on the grounds there. So patients would come to that area. They've seen the message. They know, everyone's welcome to come if they have an eye issue or concern that they wanted looked at. So about 5 a.m., patients will start to line up. By 8 a.m., we're definitely starting to see them. 7:30, 8 o'clock, we start seeing them. And then they are lining up all day long, and up to like dinner time is, we're just going.
How many days then were you doing that?
We were doing the active care for 5.
5 days.
And then the last half day was for the last bit of post-op.
So how many patients did you see yourself, would you say, on average?
That's a great question. I'm thinking, like in the day, it's just go, go, go. So like, I don't even know an estimate, but between
probably.
Definitely
Daily.
100. Because between the three
Which, just for comparison, it's 20 a day usually, right? So probably 5 times more than what you would on a normal day. What are the type of things that you were, seeing and helping people with?
Yeah, so there's 3 of us set up, 3 different bays.
Yeah.
We saw a little over 1,000 among the 3 of us in the 5 days.
Wow.
So we are seeing age ranges from, I'd say, anywhere from 5 up to however the oldest patient was, 90. The biggest need was just very hypermature, dense cataracts. So patients walking around
something we
seeing
totally take
shadows.
for granted, right? Because we have cataract surgeons get cataracts easy. It's covered by all insurances.
Yes. Yes.
Same day you're out, easy peasy. So can you tell us a story about, someone who really their life was changed as a result of this?
Absolutely. Yeah, no. So for example, first day, patient comes in, sits down thinking, oh, maybe glasses will help me, because they don't know what exactly is going on. They just know they suddenly, over time, have lost their sight.
Sure.
And we're checking their vision, and they're not seeing you until you're right here in their face. They see your hand moving.
Right.
That's the extent of the vision.
Right.
It's a hand moving in your face. There's nothing else that they're seeing.
Wow.
So, looking at them with the slit lamp or the little lights we have, we know it's also very minimal. The equipment is different. It's portable, and we're sharing it. So looking at him, very dense cataracts, we say, okay, yeah, you're someone that we can send you over to the surgeons.
Right.
They'll take care of you. So same day, they're going over there, getting surgery.
Wow.
And so the surgery procedure is very different. We don't have to go into the details, but it's obviously a very different environment. Multiple surgeries happening at once, different type of surgery. It's more invasive in the sense that
they don't have all the great technology, right?
Right, but great outcome. So he goes in, gets the procedure done, and we're seeing him the next morning at 7 a.m. for the post-op, and they come back because they've had the bandage on for the whole night.
Sure.
Take it off, and they can see.
Yeah.
Oh my gosh, the most beautiful, heartwarming thing.
Yeah.
Patients are crying because you take it off and all of a sudden they have sight again, like the sight that was missing. And it's just a beautiful, humbling experience. So many patients created so much emotion in us, just being so thankful for having that sight return, even if it was just one eye at this time. It's such a difference to have.
And we
sight
take
back
it for
in one
granted
eye.
here, and we're just so lucky. We're so lucky to have access to the care that we have, and we're so lucky to be in this community and provide that care. And so, we want to tell you, if you're in need, you don't have insurance, you don't have access to glasses, you don't have access to surgical care, we're here for you. I can't tell you the number of times that we provided free or low-cost care, free low-cost glasses, lenses to people in need. We do it all the time, and we're proud to do it. And so, I'm telling you, this wonderful story here, Dr. Sran, provided that care to third world country, people in need, wouldn't have got that care if she didn't go there. But it also inspires us and Dr. Sran to do that right here in this community, in all of our locations. We're here for you. So if you need something, don't hesitate to call. Tell them you heard me say it on the show. Eyecare Today. We will help you. You have my word. And Dr. Sran, wow, amazing job. Thank you so much for going there, helping hundreds of people, maybe even thousands of people live a life that they deserve to live. We're walking on the same planet, people. Thank you guys. We appreciate you tuning in to another Eyecare Today. We hope you to see you in one of our 4 locations. Have a good one.